All right, good morning. Happy Monday Mobility. Today's focus is going to be a little bit, we just keep getting a little more specific as we do more and more things. So let's understand the pelvis really quick. It anchors lower body function. So thus the function or the structure of the pelvis is that this is two pieces. The right ilium and the left ilium, and it connects at the pubic symphysis. There's a joint on the front, and there's a joint in the back, the sacroiliac joint. The sacrum kind of drops down into the pelvis, and the pelvis then can function as two pieces. And to have great lower body function in any sport or even in life, we want the pelvis to move this way. So that when you walk or run, the pelvis can I do it like this, but it doesn't move that much. But it has to move enough that we get that glide and slide through this joint right here, through this junction. That joint gets out of whack just a little bit to the upside. We call it an upslip on one side, or it gets stuck. It won't necessarily get stuck in posterior that often, but it could get stuck, tucked under. More often than not, we're going to get a tightness on the front side of the body, primarily from sitting. We tend to blame the psoas muscle, but it's really a function of the entire anterior hip complex. So let's spend a little bit of time acknowledging that we need mobility in the pelvis, but we also need that when we do our landings, when we're walking or running, we also need stability. And we need this sequencing of musculature within each side that makes sense to the body that will actually allow for mobility. So stability is really important, but so is mobility. So we're going to start very, very simple. Probably one of the safest ways to try to encourage mobility through the SI joint is through this quadruped position, right leg slightly in front of the left, so we get a little bit of offset in the lower body, right leg in front of left by about 2 or 3 inches. It's very subtle. And we're going to put the fingers and the hands directly under the shoulders. The head is neutral, and we're just going to roll to the back and to the front. Just very gentle shifting back and shifting to the front. Let's do 10 of those. Right leg is in front of left. 2, 3. You won't feel much, but trust me, your hips are moving if they're not stuck. But even if they're stuck, this is going to encourage gentle safety and mobility. So it's a really good way to start the day. Okay, let's go the other leg in front now. So left leg in front, you don't have to do what I did, which was a full 360 or 180. You don't have to do that, you just switch the legs, okay? So head is neutral, shoulder blades aren't locked, and we're just gonna glide. Glide forward, look over the cliff, and then hips behind the knees. 3, 4, 5, 6. This is how I'll start most sessions with my high performance athletes. And high performance, I'm going to give that nomenclature to anyone who wants to find their best, right? So anybody who's training on the edge and working towards progressive overload in swim, biking, and running, or hiking, or whatever they're doing, it means they're finding that edge of the body. Okay, this next position is just 2 knees to your chest. You should have a nice flat low back, so you shouldn't be able to get your hand under your hips. And then we just lower the feet to the ground, and we do this very slight pelvic tilt to pull pubic bone to belly button. And we have nice flat hips here. We're going to go 10 bridges. So from right here, we're just going to lift the hips, and you can see how high I can get my hips. Glute is activating on its own. I'm not forcing an activation. 2, just have nice flat hips, and I'm able to maintain neutral. 3, 4, the tighter your hips are, the more you're going to struggle with coming down and continuing to have that flat back. 5, 6, good. I'm starting to get some medial hamstring activation. 7, not from anything I'm encouraging, it's just happening. 8, 2 more. 9, keep those knees in, maybe touch them when you get to the top. Right there, touch the knees, come back and come back. Good, let's widen the feet out. We're gonna go right into nice, easy, happy hips, also known as knee toggles. So we're just going side to side. 3, 4, 5, 6, and we just kind of want to push that back knee into the midline just a little bit. 7, 8, 9, and you can start to feel a little tightness in those quads. 10, and we're slowly starting through mobility. We're starting to get this loosening up of the hips. All right, so let's go ahead and straighten both legs. When you straighten both legs, it becomes a little more difficult to hold the low back to the ground because now the hip flexors are long. So if they're tight, you're going to really start feeling pointy hips and you're going to feel space in your low back. So right here, we've got nice neutral hips if you can get there. Don't worry if you can't. And we're just going to go alternating knee grabs. And it doesn't mean we're yanking really hard. We just have this understanding that if I bring my knee to my chest, it's going to pull the pelvis out of an anterior tilt and encourage more of a posterior or neutral pelvis. 2, 2, we're going to go 5 each side. 3, 3, 4. We're coming into World Championship season in the fall, and a lot of people here getting to the end of the summer, maybe not paying as close attention to the body mechanics as they used to. Wide feet, we're going back to the knee toggles. So just let both knees fall to the left, both knees fall to the right. Now, a little bit more emphasis on length. So we're taking that leg that's on the top, the hips that's at the top, and we're creating space through the hip. So right here, I'm pulling the knee away from the rib cage and starting to encourage more space in the front side of the hip. As we start moving muscles and tissue, connective tissue, we're going to start getting more length and kindness because we're getting more circulation. We're getting more fluid exchange in the tissue. So the second time here through happy hips should be different. Good. 5 and 5. Nice. Okay, this time, want your feet a slight internal rotation. So heels just slightly outside of the toes. So the lower leg is beginning to internally rotate. The knees are a little bit more encouraging towards the midline, and we come up into that bridge again. 1. So this time we've got a little more internal rotation of lower leg. Knees are a little more towards the midline as we go back to our bridges. Stability. 3. Length, activation through the backside of the body, backside of the hips. 5. We're going to go 10 of these. 6. 7. 3 more. 8. Good. Starting to feel, I'm feeling my low back a little bit, and that's fine. That means it's starting to work. It shouldn't be that the low back doesn't work. It's more of an accessory though. When it becomes more dominant, it's because the glutes become less active. The glutes become less active because you're a little bit stuck in anterior, right? So let's go ahead and take the lower body now and anchor it. Knees in and touching. Low back definitely can be off the ground because knees in and touching will encourage a little bit of an anterior tilt. Not a lot, but enough that it's going to be a functional tilt where we don't mind living, right? So knees together, toes together, heels apart. Pull the toes towards your shins. There's your anchored lower body. From there, we're going to breathe, but we're going to create more space through the thoracic spine. So we're taking the fingertips together and reach way over the head. Walk the shoulders so you create as much space as you can between the ribs and the hips. And now we're going to work the diaphragm and the muscles of respiration, which play very intimately with the pelvis and the pelvic position because of its interaction with the pelvic floor, right? So knees together, toes together, heels apart. Reach your hands overhead, but don't have your fingertips on the ground. We want them about 6-8 inches off the ground. Nice big reach through the shoulders, knees together, strong stomach. You should feel really quite skinny here. And we're just going to create 5 huge breaths. Expand the rib cage. Ready? Here we go. One more big breath. Expand the rib cage. And good. All right, so let's take that back into quadruped, back up into all fours. And we're going to reach through the thoracic spine. We're going to come back to that supine decompression breathing with a couple more rules in just a second. So right here, let's go onto all fours. This time the knees are parallel. And we're going to take that left hand, reach under, and reach palm up. Now, if your SI joint's tight, you're going to feel this as you rotate through your thoracic, alternate sides. You're going to feel that in your SI joint, through your low back. 1, 1. 2, 2, we start to move through the rib cage. 3, 3, 4. It's not unusual if you feel it more on one side than you do the other. My left SI tends towards getting a little sticky. So when I go with my left arm, I can feel that through my SI. So maybe it's not even my left SI, maybe it's my left rib cage. Maybe, don't know. All right, let's take it right back to supine decompression breathing. This time we're differentiating between belly breathing and decompression breathing, 2 different examples of breath. Pull your belly button into your spine. Maintain stability through your transverse abdominals. This is important in performance. Belly breathing, great, good for you. This is not belly breathing. This is creating stability through your midsection so that we can stabilize the part of the spine that we want to stabilize, which is the lumbar. Right? So let's go. Knees together, toes together, heels apart. Low back can float just a little bit off the ground. No big worry there. Fingertips together, reach over your head. You can touch the ground with your thumbs and then bring them back up to about 6-8 inches. Walk your shoulder blades away from your hips. This time as you inhale and expand your rib cage, you want to keep your belly button in. Ready? Here we go. 5 breaths. One more. Big breath. And good. Let's take that up onto one knee. So a nice, safe half kneeling position. If you're not comfortable in half kneeling, you can do this from a standing position. But if you need a pillow under your knee, I want you to be comfortable in half kneeling. It's a really wonderful way to take the lower leg out of the equation. So much can be going on down there that if we can just eliminate it from the conversation, we can get more activity and attention to the pelvis. So half kneeling is a nice position because it just eliminates the foot and ankle. Okay, so right here, we want a flat hip on the left hip. The left knee is down. We're not going to actively fire the glute. We just want to encourage, so I can even just pull up just a little bit, create space on this left hip, stay nice and tall, and then we're going to take that left arm straight up. And I want you to go ahead and feel like you're dropping your left butt away from its shoulder blade. And just this nice big reach. From right here, we're going to breathe. 3 big breaths. and good. So picture it, every single time we expand the rib cage, we're getting this expansion up here, which is creating length and tension in the upward position. So half kneeling on the other side, right knee is down. We're not going into a big forward lean, we're just neutral, okay? So go ahead and encourage space on the right hip, on the front side, and a little bit of a drop on the left side, and that shortens the hamstring. It gives the hamstring a little bit of relief from being in that anterior tilt where it's living on a stretch, right? So nice, comfortable there. I'm going to take my left arm and just put it behind my back, leaves that left side open, and then right arm up, and create as much length through your fingertips as you can, tension in the fascial system. We're going 3 big breaths. The back side, we're encouraging it to drop, and the front side, we're encouraging space. Fingertips have tension. And good. Let's go one more time on each side. This time we're going to encourage a little bit of knee over toe. So right side is up, left side is down. We've got hopefully a flat hip here, which shows us we have a neutral left ilium, right? We're just going to go ahead and take that right knee over toe, and we're encouraging and getting more space on that left side. 2, 3, and we don't want to be way back here, but stay strong and upright with your upper body. 4, 5, 6, let's go 7 of these, feels good. It's a nice little stretch, but we've taken how much time, like 12, 14 minutes to be even able to encourage this stretch. It's not where we want to start. We want to be gentle. We start to make deals with the body. Give us some length, give us some space, but we have to take the time to get that. 2, now nice and upright, great head position. 3, 4. So many times I see trainers and people doing this. What do you think that does? That kind of encourages that. So we want length and space through the head. A great head position shows this stack, right? 5, 6, one more, and 7. So even if you have a new hip, I work with a lot of athletes who have gotten new hips and new knees even, and we do this same kind of protocol to get space and mobility through here, and then we build stability, your ability to hold it in the right position, and then we add load to get stronger. So nice and wide with the heels. There's a patient process to this, and this is what allows the kind of programming that can last a lifetime. If there's not length and space in the body, I would argue that that body shouldn't be loaded with external load that much. Okay, so we're nice and stacked here. Hips are over ankles, head is over chin, chin's into the throat, ears are over the shoulders, and we're just gonna push the hips back into that hinge just a little bit, maintain length and space between the ribs. We're gonna drop that right hip to the midline. As soon as the hip stops, the shoulder stops. Same thing other side, 1, 1. Keep the hips to the back, 2 to 3 inches. 2, 2, 3, we've got a little more force now because we've got gravity and ground starting to have that impact on the skeleton and how we hold ourselves against gravity. 4, 4, one more. 5, and 5. Okay, out of that same thing, we're going to add intensity. We're going to add more rotation through the T-spine. So we're going to work the hinge, butt to the back, and now we're just going to rotate and reach right down the midline, push that hip to the back. So we reach right, we can almost push back left, and then we reach left and we push back right. 1, 1. 2, we got the weight of the arm, adding a little bit more activation to the posterior chain, and we get a little more hamstring activation. That's okay. The hamstrings should work, but when they're tight, they're not strong, they're just tight. So here we're getting hopefully appropriate length And that gives us the opportunity to truly build strength. All right, good. One more big move. We're going to set you into an anchored stance. So we're paralleling the outside of the feet. Don't go into a pigeon-toed position. That's not what we're asking for. We're going to get that fifth metatarsal, that pinky toe. Make it parallel. From right there, push the hips to the back just a little bit. And we've just got a very healthy position, internally rotated hips. From here, we're just going to let the hips come to the front and then bring them back to the back. So shoulders into the back seat just a little bit, hips into the front seat, 2, 3, getting a little bit longer through the belly, 4, and 5. Now let's add the arms. So we're going a big reach up. Here's our stack, hips to the front, arms to the back, a little bit of strength, a little bit of activation of the front line. So right here, we're pretty balanced. We can drop the sacrum. Now we're just going to let that front line load and come back. 2, 3, not too far. We're not trying to get you all the way to the ground. 5, 4, one more. Load the front line of the body. So when we talk about the anterior tilt, again, most people are like, oh, you have a tight psoas. I'm going to challenge that thinking that it's not just the psoas. It's going to be everything through the front side of this hip. It could be up into the diaphragm that's actually causing an anterior tilt. It could be a weakness and lack of activation in the belly. So we want to be able to stack. We want to be able to stack with the arms overhead because it shows length in the lats, and the lats can actually help lift the body and create this lift, this tensegrity. And then we want to create strength. Thank you for joining me on Monday. We've hopefully opened up your hips, given you a little bit of gentle reminder. These are daily routines that should just keep bringing you back into neutral, which is a killer place to start your day. See you guys. Happy Monday.